All right, welcome guys. This is Dr. Price, and we're going to cover my highest yield dermatology review for the IM shelf as well as USMLE Step 2 and Step 3. So for pediatrics, we're going to cover all kinds of different skin lesions, including strawberry hemangiomas versus cherry angiomas. We're going to cover erythema toxicum neonatorum, nevus flammeus, nevus simplex, diaper dermatitis. And all right, let's dive right into it. So here's your reminder before we get started. The things that trip up students the most on the exam. We're going to go through the topics that if you are very shaky on these, before we even dive into these details, you should take some time, check your first aid, look at some pictures, and figure out in your head a basic framework for the following diseases. So bullous pemphigoid versus pemphigus vulgaris, always tested. SJS versus TEN, tested very frequently. Lichen planus, they love to hit this one. Psoriasis. Various fungal infections and treatments. Sketchy is really critical for this. And then compare and contrast squamous cell carcinoma versus basal cell carcinoma versus malignant melanoma versus actinic keratosis. And we're going to go through all the management workup for all these. And then make sure you know any kind of conditions that are high yield associations with each dermatologic disorder. So, number 2, for dermatology questions, here's a huge test taking tip. I always look at the images first before I read a single line of the history. This will save you a ton of time, and you can often discern the correct answer and save yourself 60 plus seconds of reading just by knowing your imaging. Number 3, another test taking tip here. When doing dermatology questions, immediately assess, do you think this question is infectious or autoimmune or medication induced? So look for fomite history, look at family history, look to see if there's any recent medication changes. These are all very, very helpful. And then also see, is this a dermatomal distribution or is it widespread over the entire person's body? So these two simple mental algorithm cues can really help you rule out 50% of the answer choices in many, many questions. All right, so let's really dive deep into this information now. So number 4, strawberry, also known as infantile hemangiomas. The treatment is propranolol if these patients are ulcerating or if it's on the face, the liver, or subglottic. And so you have to know that. You don't just treat every single strawberry hemangioma. You treat them if the skin is ulcerating or it's on the high-risk areas, the face, the liver, and subglottic region. Obviously face, because that could be potentially disfiguring. The liver you want to watch out for with a liver ultrasound. These patients are at very high risk of high output heart failure, which we're going to talk about down here in just a second. And also the subglottic region, because you want to watch out for breathing difficulty. In most patients, however, strawberry hemangiomas are going to regress by age 5 to 8 years old. And so a correct answer on your USMLE might be just watch and wait until the patient is 8 years old, and it will most likely be resolved. And so if it's, let's say, on the arm or on the leg or on the torso, that would be your next best step as long as the lesion is not ulcerating. And so if they have over 5 strawberry hemangiomas, your next best step is to get a liver ultrasound. Oftentimes, there's going to be strawberry hemangiomas inside the liver. And so watch out, like I said, for high output heart failure. Anytime you see a condition on the USMLE that tests and it has an association with high output heart failure, you got to memorize it. It shows up all the time. If there is a facial strawberry hemangioma, your next best step is an echo and an MRI of the brain. You got to do that because it's associated with face syndrome. And so they can have posterior fossa abnormalities for P, H for hemangiomas, A for arterial anomalies, C for cardiac anomalies, and E for eye anomalies. And so they can have these lesions all throughout their vascular system and their heart, as well as in multiple locations in their cranial fossa or their face. And so if you see cervicofacial strawberry hemangiomas, your next best step is going to be a laryngoscopy. And if there's a lumbosacral strawberry hemangioma, you want to consider a spinal ultrasound. And here is what your picture is going to look like on the test for a strawberry hemangioma. This is one of the most commonly tested pediatric style questions for dermatology, but it can also show up on your shelf exams for the other specialties such as IM, family medicine. It can show up on your step 2, it can show up on your step 3. So make sure you know all the next best steps scenarios, as well as the treatment if it's ulcerating or on the face, liver, or subglottic region, which is propranolol. All right, next is cherry angiomas. These will often increase in number with age compared to the strawberry hemangiomas, which usually regress with age. And so the treatment for cherry angiomas is reassurance. If it's very bothersome to the patient, you can consider electrocauterization, but generally it's just reassurance. And they look something like this. And I have one or two of these. You just get them as you get older. So maybe I'm getting older, I guess. Number 6, erythema toxicum neonatorum. And so these are benign asymptomatic papules and pustules that resolve in the first 2 weeks of life. So your next best step will be to reassure the family. Usually it's just little bumps that the baby might have. Not a big deal. The thing that tricks up students on the exam is it's called erythema toxicum neonatorum. And so they see the word toxic and they think that it's bad, but really these are just benign papules or pustules that resolve after 14 days. So don't be fooled by the word toxicum here. Hopefully I nailed that down enough times that you guys put that as an association in your mind. Next is nevus flammeus. These patients will have the port wine stain that you guys all remember from step 1 studying. And so this is going to be blanchable and it does not cross the midline. So the next best step here is a brain MRI to look for leptomeningeal vascular malformations seen in Sturge-Weber syndrome. So mega high yield association, if you remember back to the beginning of this, I said know the associations that the disorders can have with them. So for Strawberry hemangiomas, we talked about the face syndrome, PHACE. For nevus flammeus, we talked about Sturge-Weber syndrome. That's another high yield association. So make sure you tie those associations to the lesions themselves. All right. Nevus simplex almost always is going to be on the back of a baby's neck. And so these are blanchable pink patches. They disappear with time. You don't need to do anything. You reassure the patients as well as the mom and dad. So obviously the baby, you're not reassuring a whole heck of a lot because they don't know what's going on, but you want to reassure the family. Number 9, diaper dermatitis differential. Super high yield. You got to know this, so tune in for 1 second. You'll almost guarantee you get questions in UWorld or on your USMLE for this topic. And so there's irritant contact dermatitis and there's candida dermatitis. Those are 2 of the highest yield here for your differential that I want you to know. So irritant contact dermatitis will spare the skin folds. And so you look at the baby's creases in their legs and it's spared. There's no erythema there. It's nice and peachy or whatever a baby's skin color is, nice and pale. And so oftentimes this is after a recent diarrhea illness and it's just irritation. And so the treatment here is any kind of topical barrier. So they say put on zinc oxide or petroleum. That can often help out these babies. And just as a side note, if you've ever worked with elderly patients that may be incontinent or get irritant contact dermatitis with their briefs that they wear in a nursing home oftentimes, zinc oxide is what we use there as well. I was a CNA before I went to medical school for about 5.5 years, and we use zinc oxide every single day for that contact dermatitis where the patient's briefs were on their legs. And so candida dermatitis, on the other hand, is going to involve the skin folds and it will have satellite lesions. I want you to drill into your head right now. If you hear the word satellite lesion and you're thinking, is this fungal? Is this an irritant? You are going to go immediately with candida dermatitis. And so candida itself is notorious for having satellite lesions. Whether we're talking about candida that's in your eye, candida that's in your groins, look for the buzzword satellite lesions. And so the treatment here is going to be a topical antifungal. So look for something that would treat candida. You got miconazole, nystatin, clotrimazole. Those are all fair options on your exam. And oftentimes these patients will have a history of recent antibiotics, and that just basically decreases the normal bacterial skin flora. And so candida takes over after that.